Okay, so my mother and I have been talking. We're not exactly sure when I got this next technique. We think it's around 11-ish.
Around 11-ish.
Somewhere in there. So that puts it like 1994 or so. It's Pulmozyme. Pulmozyme is an inhaled drug. It comes in this fancy little vial right here. You squirt that into your nebulizer and you hook it up to your Pulmolade and smoke it. What it does is it gets into your mucus and it slices off the extracellular DNA to thin it out a little bit. It comes nowhere near normal people mucus, but it's thin enough that you can move it along much better. And it just takes 8 to 10 minutes.
Once a day, every day.
You sit there and watch The Simpsons while you do that. Pulmozyme is great. Like, I love Pulmozyme. It was a huge revelation to us. And the best endorsement I can give Pulmozyme is that when I turned 18 and for a few years after, I had a lot of insurance issues. And it's tough to get Pulmozyme because each one of these vials is like $80. The drug itself, like a month's supply, is $1,800, and I know that because one time I had to charge it because I had some insurance issues, and if the insurance company is going to buy it for some reason, it's $1,500. If I'm going to buy it, it's $1,800. But buying that cleared out, that's a story for another time. I bought it, it got me insurance. But anyway, I did a week without Pulmozyme.
You looked awful.
It was awful. I couldn't talk, and the moment that really triggered it, that I decided, you know what, we're just going to buy it, is when I started coughing up blood. And I remember my buddy worked at a youth center at the time, and I had been visiting him, and I was talking, and I started coughing, and he goes, dude, is your mouth filled with blood? I'm like, I don't think so, because it just felt like spit. But then I spent a solid half an hour spitting blood into the youth center toilet, which, as scary as that was, I also looked pretty awesome. So it balances out. But around the time that we got Pulmozyme, what we would do is I would take this, again, about 8 to 10 minutes, and then we would do the postural drainage afterwards. So you thin the mucus, then you move the mucus. And we say, what, like a year or so before we got the flutter?
Yeah, good year.
All right, well, the flutter is a little gray pipe-like device that you blow into, and it sort of regulates the pressure in your lungs while it's shaking the mucus out of them. And I'll open it up here.
Little metal ball.
It's a metal ball and this little cup here. And you put the whole thing together, and I'll do it without the top on so you can see it.
And that's the achieved effect.
You have to do it like, anytime you go to blow in something, you always want to go like, but cheeks have to stay really steady, which was tough for me when I was younger. I used to have to hold it. And if you hold it straight, vibrates your lungs / mucus at about 15 hertz. If you turn it up a little bit, you can turn the frequency up. You turn it down, you can lower it. I don't feel like it's quite as effective as the postural drainage machine was, but it was much easier. So I would do it a little more. But also, I could half-ass it much easier. Like, yeah, we're done with that. And then you're on to playing Street Fighter 2.